Area of medicine has opened back up with organ transplants once again taking place. Joining us now with the latest is Dr. Oscar Serrano, transplant surgeon at Hartford Hospital. Dr. Serrano, thank you for being with us.
Thank you for having me.
So tell us about how COVID-19 specifically impacted your transplant services.
So COVID-19 in Hartford Hospital significantly impacted the transplant program in the months of March, April, and towards the end of April, we started to ease up on those restrictions. The most important one was the suspension of our living donor kidney transplant program. At that point in time, it was not prudent to have it open and to have living donors come in and donate their kidney. Throughout that time, we were also very selective in terms of who we transplanted from a deceased donor. But at this point in time, since we've been seeing very positive results here at Hartford Healthcare, we have started to ease up on some of those restrictions, and we are continuing to transplant individuals that are in need.
And we saw that earlier in your story that Samaya Hernandez did. Congratulations. That was so great to see. So with surgeries resuming just over a month now, where are you in terms of volume? Are patients coming back?
So we are still seeing a lower volume than we were before in terms of who comes into the clinic, who is actually getting transplanted. Many of our visits have now been switched over to telehealth visits. So we will see patients. Yesterday, I actually saw 2 individuals over a televisit. We are trying to select out individuals who need to move forward in the process in order to be listed for a kidney transplant or for a liver transplant, who may not necessarily be as sick or have as much dialysis time in the case of kidney transplantation. We are also selecting out individuals who may be healthier, so younger individuals, individuals who may not have had a lot of medical problems. And these individuals, we find that if we are able to evaluate them through the computer system or Zoom or another media, then we can move forward in their evaluation so that they can continue to work towards becoming a candidate for transplantation.
Okay, so you just provided a talk for the Association for Multicultural Affairs and Transplantation about the effect on racial and ethnic minorities. Can you tell us a little bit about that?
Absolutely. So the Association for Multicultural Affairs and Transplantation is a large organization. It's a national organization that's focused on easing healthcare disparities, in particular in transplantation. We know that COVID-19 has had a significant impact in communities of color, African Americans, Hispanics, Asian Americans, Native Americans. And so what I'm going to be doing in this webinar is basically putting out the evidence out there for what we know so far. We know that COVID-19 has also had a significant impact in transplant recipients, with mortality rates much, much higher than the healthy adult population. We see mortality rates in the 30 to 40% range. We also see significant differences for individuals that are older who have had a kidney transplant or a liver transplant. So what we are going to be learning in this webinar is about how all of that, in addition to being an ethnic minority, has an effect on outcomes after a COVID-19 infection.
And doctor, tell us how COVID-19 has affected donation rates. Do you need more donors?
Well, we always need donors. With COVID-19 or no COVID-19, we always need more donors. It has significantly impacted donation, both live and deceased donation. For a period of time in much of New England, as well as the rest of the country, the living donor transplant programs were closed completely. So that donation rate went effectively to 0. The deceased donor rates were also significantly impacted. In New England, I can give you the example. Donation rates for deceased donors went from doing about 25 to 35 deceased donors per week. Those are individuals that have already died and donate their organs for transplantation, to about 5 deceased donors per week in the time span when we were at the highest COVID risk. Of course, this had a lot of implications for what we do.
All right, Dr. Oscar Serrano, we thank you for joining us there. We really appreciate it. Some great information. Get the word out for donors. Thank you.